talking about school supplies. If you are a parent, you might be thinking about your children's health. Obviously, school's coming up, but what about your children's health? All of that worry starts from the moment of conception. Dr. Jeremy Groll joins me now to talk about genetic testing, some of the advancements that are happening, and a whole bunch of new breakthroughs that are coming. Welcome back.
Yes, oh, thank you, Katie. And yes, it's really a very exciting time right now, especially in reproductive medicine, but for medicine in general, with what we can do now as far as testing for diseases before the pregnancies happen.
Oh, wow.
And so now that we have, basically about 1 in 33 pregnancies are complicated by a birth defect, and many of which are genetic disorders. And we have also about 1 in 15% of pregnancies are lost to miscarriage.
Wow.
The leading cause for miscarriage is genetic imbalance with chromosome problems like Down syndrome.
Okay.
And so now we have the ability to screen for many of these disorders preemptively. And in the old days, and I used to do genetic testing and the sequencing back in my research days, but we would have to do one gene at a time, and it would take months to try and find the defect, and it's searching for a needle in a haystack. We now have a test that can test for over 250 diseases and runs simultaneously about 2,000 gene mutations, and it's off a simple blood draw for under $100.
Wow. And you can do that right in your offices.
We do it right in our office, and we've already been testing for people coming through SpringCreek, and people who have unexplained problems or they've had testing that's never turned an answer. Now we're finding things that would have otherwise never been able to identify. And not only can we find these things, but through in vitro fertilization, that we can actually biopsy the embryos and test those for those disorders, so that then identifying the embryos for a pregnancy that is free of disease.
Sure.
And with that, we're proud to say we're the first center in the Miami Valley to actually do these, and we've done those this month for the genetic testing, so very exciting. And that aside from just identifying these problems, it also allows for reduction of miscarriage, and so that with also single embryo transfers, that we're able to get pregnancy rates over 70%, putting in embryos one at a time. So that also reduces the risk of twins and the complications of pregnancy that we see with that. So
amazing. Research can really help, and as we mentioned, can really help calm some nerves for some new parents as they're navigating that journey. Where can we find more on you, and obviously come in and see you and talk about some of these things?
And so we're at SpringCreek Fertility, and that we're located over in Centerville at the corner of Alex Bell and Clio Road. Address is 7095 Clio Road, and they can either find us on our website at springcreekfertility.com or give us a call at 937-458-5084.
Dr. Jeremy Groll, thank you so much for being here. Thanks for helping ease some of our concerns.
Oh, thank you so much.